the interview season is an exciting one, I think, because the interview offers are going to start rolling in. A lot of you have already started receiving some of the interview prep invitations, preliminary phone calls and virtual invitations. And you've been reaching out about how to respond and how to respond to the request and when to record, when not to record, and when to pick the phone versus a virtual video and things like that. But it's such a great victory for you because it's affirmation that the packet you've submitted is a competitive one, because an interview offer is essentially the program's way of telling you that they are interested in the packet you've put forward. So the interview is now your opportunity to go in and defend the packet and really, really make a stance for your candidacy and your position, and make your case as to why these programs need to not just rank you, because the interview alone is a sign that they want to rank you. But when you go into the interview, it's about how to make sure that you are ranked so high that your chances of maximizing a match are great. So we're going to talk about a lot of different things, and today with this workshop with that. And so one of my primary objectives, I have three main ones here today. The discussion doesn't have to end here today. So if you're interested in more one-on-one or more targeted guidance with the interview prep, absolutely. The people enrolled in the program already know that this is definitely part of your package, and we will have multiple of these as you prepare. But this is more for everybody else who's interested in more guidance and wants it. Please reach out and I will interact or schedule as my schedule, my time allows for it. I want you to understand the goal and purpose of the interview. There's definitely a reason why they want to interview you, or why they want to interview you multiple times. It's a great sign each time you're called for a comeback, or each time you get a step closer. It's a great sign that you're doing well, but you have to understand that with each step that you move forward, there are different expectations for the interview. All of this essentially works up to one endpoint where by the end, they have a good sense of who you are, and you've done a great job laying out and mapping out what your plans are. And it is extremely clear how they fit into that, right? Successful interviewing is just removing all ambiguity out of the thing, like whatever was in your letter of intent that wasn't cleared, you want to make sure that all of the doubt and ambiguity is completely gone as to why this program fits into your plan. Preparing for the interview, we'll go over, and as well, understanding that like how one person answers a question may not be a fit for how you approach that same question. One, your life experiences are different, but also your level of confidence, the way you articulate certain things are completely different. Like somebody could say, I'm very tenacious, versus another person just saying like, I am incredibly tenacious, and this is evident by this and this and this and that. So listening to one person deliver their response to one question in one way, it's great because it can give you an idea of how you could structure that same response. But I want to warn you against replicating others' responses and thinking that because it worked for them, it could work for you as well. That's why interview prep videos could kind of be like a trap. The goal is for you to learn about them and the position more intimately. And I really and truly believe in the power of being present in a space and the energy of that place, like doing something for you, right? Like with each interview that you go through. So I applied to 12 programs and got 9 interview offers, right? Each campus I stepped on, I got a different vibe. The vibe was different. And then the place that I ended up ranking number 1, it's very silly, but the blue, there was the blue everywhere. And I really loved that color. And I don't know what it was, if it was the ceiling or if it was just the way the light reflected in the atrium, but I fell in love with the blue and the fact that it was everywhere I went. It was on the doors. They loved that color, was just everywhere. Like their brand was evident all over Center City, Philly, despite the fact that Temple University Hospital was like a couple blocks down the road. But all of Center City was essentially Jefferson, Jefferson, Jefferson. I loved that dominance, and I loved something about that just spoke to me, right? They want to discuss your qualification, your skills, but your fitness for the program, right? Like A program, you could qualify for the program and not be a fit for it. That's okay. Like that really, really has to be clear that it's possible that you could have all of the skills and qualification for a program, but you're not a fit for it. So an example of that would be perhaps your dreams and your goals are really, really specific and they're really big. So a program may look at you and just say, like, we could stifle them. Like if we rank her here or him or her here and they match here, we could actually stifle them versus there's another program out there that literally has the right path to help them get there, right? So it's the whole overqualification thing. So a program doesn't want to match a candidate that they know is going to be miserable because they're not going to be able to meet your expectations of what you want them to do for you, for what you want to do next. So keep that in mind too. And it's also a time for you to address and put to rest any reservations about compatibility. There are going to be other residents there. You will likely have lunch with the current resident, or you'll have an opportunity to interact with past residents. And you can ask those residents questions away from the director in a more intimate setting. And that should help you, because one of the questions I remember consistently asking every resident is, what was it in your 3 to 5 year goal that made this program a fit for you, right? Their responses really, really helped me see that, okay, they want to do infectious disease or they want to do a fellowship next. And there's an investigation of drug services here. I could see how that fit. But if you want to specialize in pediatrics and then you're here and there are no opportunities for any pediatric rotation, then I'm kind of confused. Like, how did you end up here? Or why did you come here? So some of those targeted questions, you can get a vibe for like how people end up where and how they made their selection process based on asking some really targeted questions. There is a way to respond to invitations. More commonly, like I feel like in the last 10, 15 years at least, they have been coming over email. You have some programs that are still very, very traditional. They will actually call you. So if you're a person who doesn't answer numbers you don't recognize, you may need to adjust this behavior between now and March, because some programs will call you and they may leave a voicemail, and then like you'll start panicking like, oh my God, I missed the call. Then you call them back, then they miss your call. So they may call you to offer you the interview. More specifically though, now I think the phone calls are placed when they're interested in an on-site interview. And if those on-site interview, if the program, for example, pays for your flight or pays for your stay, or will arrange a car service for you from the airport to the hotel, or if they'll cover 80%, some of those logistics may be difficult to sort out over email. And so they may give you a call, or they may send you an email to say that you should expect a call from somebody in their department who's going to help with setting up travel and things like that. As far as responding to these invitations, I think it's really common knowledge that the first couple of your interviews, you're just winging it. You can do all you can to prepare, but you're far too nervous to nail it. It's not that you're not well prepared or that you're not well studied or anything, but even those programs, they're interviewing you, they know. You'll notice that they'll ask like, is this your first or second interview? If you say yes, they'll emphasize several times, please don't be nervous. It's just a chance for us to get to know you. Please don't be nervous. Everybody here is really nice. Please don't. And the more, I don't know about you, the more they kept saying, please don't be nervous. Everybody here, we just want to get to know you. The more nervous I got, right? I kept feeling like my voice would tremble the first three to 10 seconds. I start asking or answering questions before I got comfortable with each encounter. This is a normal part of interviewing, but if you get an interview invite from a program you absolutely love and you just think that this is going to be one of my top 4 ranked programs, push it back a little for the hopes that there could be other invitations that you could put in front of it. And then, because the more you do the more you come into a routine. Like when I wake up that morning, I want a egg white delight McGriddle, or I want my mom's pancakes. I don't want breakfast. I just want coffee. You start getting into an interview day routine, and you walk on campus a lot more confident and more comfortable. Try to respond to emails within 48 hours. It's just professional courtesy, because people do decline interviews. I know that that sounds crazy to say, but people do get interview invites and they decline. They'll say, you know, something has changed in my life, and I'm not going to be going forward with invitations this year. Especially if that's the case for you, responding as soon as possible so the program can move down the list and get to the other candidates, that would be great. There's a myth out there that the rejection emails come out first and then the invite emails come out next. I have tracked this actively to try to establish a pattern. There is no pattern. Like, I know for me, my first 2 emails were all rejections and I had a mental breakdown. There is no pattern to it. You could have 3 invites, 3 rejections, a couple more invites. You could have invite, reject, invite, invite. There's no pattern to it. So to try to manage your anxiety as you go through the next month and just wait to hear back. That's the only thing you can do. It really is. So there's virtual, phone, and on-site. The on-site one, I mean, as I've been doing this over the years, like 2020 was the first time we really were forced, or I really was forced to have to develop prep for virtual and telephone. Before that, everybody went on site. Like everybody. There were hardly any virtual or telephones before 2020. And so now there are rules, there are processes, and how you deal with these 2 things before you even open your mouth to continue to make yourself look good for them. As far as on-site, you could have group interviews, you could have a panel where it's you facing 5 different people, or pair, or individual. So the majority of the ones that I have had happen to people I've worked with have been pairs and individual. The panel interviews have really been for people that are looking for, that are applying for fellowships. So the panel interview style, I hardly ever see with residency, but they will pair you with another student and ask you guys questions. The questions are often identical, and it's not always that they want you to find a mistake in the other person's response, but it's to see how you would answer. If this person goes first, this interviewer, the other one would go first with the other interviewer. It's a whole process that you have to prep for. It's different from individual. Individual, it's you with an interviewer or 2 people interviewing you. And I just find that to be less intimidating for majority of candidates than the pair, right? My advice is to sign on 5 minutes early. Even if you have the utmost confidence in your technology, you don't know what technology is on the other side. You have no idea like what they're using. You have confidence in the strength of your Wi-Fi, the speed, and everything. You want to choose a quiet place and quiet area, and plain background. So I am intentionally like sitting in front of my like living room background to kind of exhibit this. Like, this would not be okay at all. Like, depending on where I move my head, you can see like the art painting behind me, the lamp and all. The background has got to be blank. Please, like, just don't, like, even if it's a painting of William Proctor, just don't. You want it to be plain because you want them listening and hearing you, and you want them registering everything about you, nothing else, right? Being in frame from the chest up, so like the view that you have of me now is really great, because whether you're tense and you're going to be leaning against a desk this way, you're still chest up and it still feels like you're talking to them. And so you will usually have like I have a grid on the right side. So I'm talking and I'm looking at that grid. When you're interviewing, you have to practice to look at the camera, right? Like, because looking at the camera is what's going to give you the greatest illusion that you're looking straight ahead and looking into their eyes. So it's like creating the illusion of like eye contact when you're super tempted to look here and look at yourself talking. That's not going to be eye contact for you guys on the receiving end versus like when I look at the camera. That takes practice. That takes a lot of practice, and making sure that you're not focusing on your gestures and things and using of your hands and all of that. Like I talk with my hands a lot. The virtual interviews, I have to do this and put it in front of me so that I am conscious of where my hands are. Like I'm tuned into where my hands are at all times, and I can keep it in front of me. So even if I'm tempted to like do something like this, I'm out of view, but it's still familiar to me as I move my hands, but it's not up here where it's super distracted. Dress professionally. No, don't wear a funky t-shirt. I have been really, really shocked by some of the interviews that we conducted where people did show up in personality t-shirts and statement don't do it. Still wear a suit, and only you know that at the bottom you're wearing sweatpants or yoga pants. But at the top, it should definitely look like a suit like you were gonna wear to go on site. It helps to practice with somebody. I can't state this enough. Someone that can tell you, oh, you're breaking eye contact, or like you're going really, really fast. You should take a beat and give them a chance to process what you said, because what you just said was really profound. Give them a beat to process that. Your pace is great, or sometimes I can hear you well, other times you're going out. You're not going to be able to assess that if all your prep focuses on is that you know the answers and you're going through the answers. Your prep has got to focus on the quality of your sound, your video, get a ring light if you need to. If your computer has really great light, that's great. But until somebody's on the receiving end, they can't really, you have no idea how you're being received on the other side. That's the point of having somebody sit with you and go through it. 1 second, I'm seeing the chat for virtual interview. So here's a question. I'm just gonna read it out before we move on. For a virtual interview, is it acceptable to have headphones on to help minimize any background noise? Absolutely. I don't see anything wrong with headphones unless they're like, like the Bose headphones, because then you'll come on and they'll just notice those. But if you have headphones, even if it's one with the string, that would absolutely help minimize background noise. It's a benefit of having excellent working headphones. If you have headphones that need to be charged, please charge them. If they die in the middle of your interview, because they have, so let's say they have 15 minutes set to say, we're going to chat for 15 minutes. Technical difficulties chew right into that. So you want to just make sure that whatever technologies you decide to use, you have tested them, you have retested them, you have practiced answering your questions with them, record yourself, like all of these things are acceptable ways. Okay, you're welcome, Joy. So that was a question from Joy. So everybody always, like, one of the main questions I get, nobody really asks me like what lighting or like what background. I think those are really overlooked, but everybody usually wants to know like what kind of questions will they ask me? Do I really have to just go in there and wing it? And no, you don't. So I am not the only person who does this. There are some universities, and I think the best one out there is USC. They have actually collected information over the years where each time their students go on residency interview, when they come back, they fill out a survey and let the school know all of these questions they were asked. And they created this database for future candidates that they can refer to help them prep, right? And since I started my program, I do a similar thing. After each of your interviews, I ask you, tell me what you were asked, and we'll go over that. Especially if you have next and future interviews coming up, I want to make sure like we go over, how did you respond to these? Okay, that was great, but here's how we're going to spice that up and present it in a more confident way. And like, we're going to articulate it this way and do it this way and do it that way. So I do, and majority of these are from some of those test banks, as well as looking at the responses that I received and matching that up with USC's database, because their database goes back something like 20 or 22 years. And so that's where these questions are coming from, if anyone's wondering, like, where did I get these? They're usually going to ask you intro questions. These intro questions, like, tell me about yourself, reigns supreme. I absolutely hate this question. It will usually be the first question you get asked, and you will be nervous if you are a modest person who's not accustomed to talking about themselves. You are not accustomed to highlighting your accomplishments in a way that you feel is going to be non-arrogant like. So it's like what I tend to call like a humble brag, right? So for all of the people that have been with me since July, we've been working on your humble brag list. We've been working on developing this list of accomplishments, cool projects that you have done. Your about me is going to be your opportunity to talk about those things and put those things forward to help you kind of stand on your own, right? They will ask you to summarize your professional journey thus far. All of these 5 questions are basically asking the same thing. It's who you are, how did you get here, and where you hope to go. As you prepare to respond to any one of these questions, those components have to be addressed, right? You can't tell anybody about yourself without starting with, I'm a final year student at this institution, and my interest in pharmacy began this way. While in pharmacy school, I have been involved in the following things. My API rotations have been a variety of patient care rotations from AmCare to institutions that have all really afforded me great learning opportunities in patient care, communication, and using some of those key words that are basically like pillars of pharmacy: communication, collaboration, teamwork, continuous learning, continuous growth. And so it's making sure that your about me is using all those clicky terms. So right away you're getting points like, okay, shit, they understand communication, they understand professional growth, they understand interprofessional collaboration, as well as interprofessional learning and things like that. Summarize your CV for me. This is your humble brag list. This is your humble brag list. I love this question. And every time you guys come back and say that you were asked to summarize your CV, I get excited because nobody should struggle with this one. We've been building this list since before Block 1 of APIs. Your APIs have your humble brag list. It wasn't just because I thought it was cool, but it's because I know summarize your CV for us is a really, really, it's a real possibility that you could get asked it, because it got asked a lot in 2020, right? What are you most proud of? They could be specific. What are you most proud of about your academic career? What are you most proud of thus far in your journey as a human being? What are you most proud of about your API year, right? So depending on how they structure the question, you can get very, very specific. I know for a lot of people, one of the most impactful answers like you would get is that they will refer to this moment that they are in front of you as a moment that they are most proud of, because many people don't necessarily think that they would actually make it to getting an interview offer, right? And this is an opportunity for you to highlight if you've had any obstacles that you've had to overcome, if you've had to work extremely hard to earn this point and this opportunity, right? This is a chance for you to let some of that vulnerability in and give them some insight in that your journey wasn't like this smoothly paved road, but it's taking a lot of hard work and grit to get here, right? Would you change anything on your academic CV or academic career, and why? It's a trick question, unfortunately, but it comes up. Would you change anything? This has nothing to do about the thing, but everything to do about you. The way you answer this question is by focusing on you, right? I would have probably learned the value of being organized a lot earlier in my academic career, because I think that learning how to study effectively could have really set me up for success since a P1 year, right? it's a trick. They're not looking for you to say that you would have done this rotation instead of that rotation, but they're looking to see how much self-reflection has gone into your academic career so far. And if you've taken the time to really think about some skills and qualities you've picked up along the way that could have been very beneficial if you picked it up earlier. It's a trick question, don't fall for it. I have questions in the chat box. I'm gonna circle back. So let's see. Okay, so questions from Janae. One of my interviews had an intro video, and then one of the 3 questions was tell us who you are and why residency. Yeah. And what is an obstacle you have faced during your professional career, right? So these are all part of the intro. These are all part of the intro part of, it's like if you figure out a way to answer one of these really, really well, it could surface in so many different ways. Like, what is an obstacle that you face, right? That is just a question, again, about something that you have had to overcome to get to this moment you are in right now. This is why I am most proud of being able to interview in front of you today, because I've had to overcome X, Y, and Z, right? And I think that's the most revolving theme with how you prepare your answers for these questions. Your answer for one question could be beneficial in like 7 other questions, because it's all about situational and an assessment of you as a person, right? So I don't want you guys to underestimate the power that taking the time and energy to prep for having a good response for any one of these, like the kind of impact that that could have on you as a candidate, right? Let's try to keep it under 2 minutes, right? Like, some people's journey in pharmacy has been extensive. Like, for me, I had graduated college, worked as a pharmacy technician for 6 years before going back to get a PharmD. That was important to me, for them to know that the decision to go back to pharmacy was one I didn't take lightly. I was very successful as a pharmacy technician when I decided to go back and get a PharmD, right? So yeah, my about me was definitely treading towards the 2 minutes. But some people, their journey has been really great. They've known from the beginning that this is what they wanted to do. They buckled down, they got through college and got through pharmacy school, and now they're applying for residency. For that person, you would fill your time with why you were interested in pharmacy, why you're interested in residency, giving specific example of things that have happened either at rotation or in your life, personal stories that have really shaped how you view what a good training or a well-trained pharmacist can do in providing exceptional patient care, right? Your letter of intent is a powerful, powerful tool. You cannot go to your interview and speak a different language than what's in your letter, right? Your letter can't talk about how you're tenacious, you have grit, you persevere. And then you're at the interview, you're talking about how you worry about how you easily give up sometimes. So your family is really a great support system to keep you going, right? If your letter of intent is speaking to how tenacious and how much grit you have, you've got to walk in there and be able to restate and re-emphasize that. So look to your letter of intent with looking at some of those adjectives that circulated in your letter and make sure you restate that, right? Start with where you are right now. Like, you're finishing school. That was a journey on its own. How did you get there, right? Recent experiences, goals, interests that have led you to pursue a residency. And close with the fun fact. Like, I always close with like, I can't color. And that was like the most astonishing thing to anybody that I would say. It's like, what do you mean you can't color? And all of a sudden, we're talking about me not being able to color and laughing about that instead of getting into these awkward questions, which is a great sign. Anytime you can get an interviewer to go off script and talk to you about your interests, you're winning, right? So a fun fact could be great. Like there's someone to interview and she was like, yeah, and a fun fact about me, I'm obsessed with sloths. I was like, what? Why? It's like, you say things like that and the person you're talking to is kind of like immediately, well, what is it about sloths? Like, in their metabolism, despite the fact that they move super slow. Like she had a whole explanation. And I remembered that. So when I walk into the rank meeting, I may not remember her face, but I have on my paper, this is the girl that's obsessed with sloths. That's a win because she was able to leave something behind that I connected with her about beyond her CV. If you can do that, you're winning in ways you can't even imagine, right? Because we don't remember faces. Like when we walk into the rank meeting, we don't remember faces most often. That's why some programs will take a picture of you because we don't remember faces. But we take all these notes about conversations and about unique things you said, because these are the things that are going to trigger our memories about what we felt and how we felt about you as a candidate when we interacted. Why do you want to pursue residency? Again, everybody who's been signed up for Resi Prep, you have this paragraph. You know this statement. This is clear because we wrote the letters of intent based on this why, right? Why did you select this institution? What do you think you will bring or add to the program? Take the time to be clear about this. What do you think you could bring and add, right? And then imagine where you are. You're at your retirement party. These are like the weird questions that they ask, right? What do you want your colleagues to remember about you and your career? All right. Self-reflection, like the people you work with, what will those people say about you at your retirement party? How does residency fit into your overall career goal? To answer this question, you have to clearly lay out what your career goal is. If your career goal is clear, for them to connect the dot of how residency will fit into that will be easy. And where do you see yourself in X years, right? This cannot be some vague answer like on a yacht for my retirement party, like, where do you see yourself in 5 years? Like, where do you see yourself in 10 years? Really, really take time to reflect on this and be specific. In 5 or 10 years, I am head of an ambulatory practice that focuses on refugee resettlement and providing chronic disease state management for this population that's grossly underserved. I see myself working under collaborative practice agreement, managing a psychiatric clinic with chronic disease state management, as well as psychiatric needs. I want to be director or clinical coordinator and practicing as well as adjunct faculty because I really love teaching and I want to be more involved in student pharmacist development. It cannot be vague, it has to be specific. I have a question in the chat. Okay. So let's see, the recorded virtual interviews, some have resources. Be sure to check all things before starting. They may have notepads to help you stay on top of answers and whether you are unlimited record, don't fall for the trap. They stress about being yourself in the email and the video for you to review and the database they use. So this is essentially like more about the virtual preliminary interviews. They will have guidelines in there. They will have tools in there, but this is new. I didn't have a single person go through this last year. This is the first time I have somebody who's actually gone through these pre-recordings. So I'm trying to learn as much about these as possible, but there's a lot of resources that they attach to those messages. They even allow you to do a first round recording, you review it, and if you're not satisfied, you get a second try to re-record, right? I mean, I don't care how happy you are with the first round, do a second one. It will always be better. just from experience, like if they allow you to do it more than once, I don't care how stellar you feel about the first one, just do it again. It'll be worth it. Your why and goal, structure your answer in the way that paints a picture, right? Like it needs to be, you cannot be difficult to follow, right? They need to be able to really, really understand, I had this rotation experience, or I had this life experience, and this is what happened, and this is what I ended up figuring out. And it really made me realize that if I want to be a type of pharmacist that can be counted on, depended on for my expertise, I want to dominate in this area. Residency is really the logical step for me to be able to accomplish that. It needs to flow. That takes practice, unfortunately. Otherwise, answering it on the fly, you may go straight to the answer without setting the stage, and then you come back and set the stage. Anytime you find yourself in an interview saying, I'm not sure if I answered your question, or you go, does that answer your question? I'm sorry, you're in trouble. You're in trouble, right? It cannot be unclear to you if you've answered their question, right? Their faces cannot trigger you into feeling insecure, like, oh, I don't think I answered their question, right? If you don't understand the question, ask them to restate it. But painting a picture is usually how you would be able, or practicing to answer your questions with examples, with stories, and then arriving at here's the how. That's like my best advice on how you're going to get through this. These are the most hated groups of questions collectively. These are your tell me about a time when. People hate these. People hate these. But I think that these are all asking for like 1 to 5 things. They are asking, how do you learn best? How do you communicate best? How do you deal with conflict? What are your challenges in the way, like the manner in which you communicate? What are your challenges in that? And like when you are stuck, like when you are out of options, and you know, not that you think, but you're sure that everything that you know how to do, you've done that. How do you deal with the fact that you need backup or you need help? Are you comfortable asking for help? Or are you the I'm going to fake it till I make it type? Or are you the I'm just going to wing it type, right? 5 fundamentals that these situational things want, right? So you did work that you didn't find valuable. And how did you deal with that, right? Like, it's like busy work. Like, how do you deal with busy work? So this is like asking, how do you deal, like if somebody tells you to do something you don't want to do, or do something you don't agree with, this one question has all of those things embedded in it. And it's about how do you respond to something like that? And I always tell everybody, if it's something you don't like, something you don't want to do, and something the answer is simple. I always strive to find the learning experiences in everything I do. Even if I am unable to find the value in that experience in the moment, I make sure that I am tuned in and engaged so that I don't miss out on the learning opportunity. You cannot say that you cannot in any way, shape, or form say that you just wing it or you just go through it. Or like one of the responses I got to this in 1 year was like, I just get it done and over with and move on. That cannot be it. That cannot be it. So just remember that it's a trap. Your least favorite and most favorite rotation, absolutely you will be asked about that. It should be easy, I think, but I find that people do struggle with it, especially if they've been blessed to have like a bunch of stellar rotations. They're kind of like, that's hard. I've really enjoyed all of my rotations so far, but the best one. So they want to see like which rotation you really loved and why, right? If you love the emergency room, then they know you're into fast pace, you're into problem solving, you're into quick turnarounds on things. If they know that you like the ICU, where you worked up your patients, you have time to talk it over, to discuss it. You may even have difficult providers where you had to work on your communication skills. It's just for them to know what you enjoyed, but also why did you enjoy it. Your ideal preceptor, or this could also be what kind or what style of precepting do you respond to best? It's the same answer. They just want to know if you're somebody who wants a lot of one-on-one, or if you're a person who just likes, I ask a lot of questions in the beginning to understand what the expectations of the rotations are. And I'm very comfortable taking the lead on my own learning and growth and development, versus I really spend the first week or so to really see how the expert in that field functions, so that I understand what they do and how they do it. And I maximize my learning time with that person in the beginning. And then I start proving myself so that that's rewarded with more independence, because ultimately that's what you want as a resident. You want to show that you're able to function independently, and more likely than not, that independence get rewarded with more independence and more independence. And what you want the preceptor to report back to your director is like, she's ready to go. Like, he's ready to go. Like, by week 3, I was just there helicoptering, but otherwise they're basically running the unit on their own. So they just want to know, like, what do you like and how do you thrive? About a time you impacted patient healthcare. I pray to God you have one. Everybody should have one at this point. It could be as simple as patient was taking half a tablet, but the medication reconciliation said they were taking a whole tablet, and they couldn't explain why the patient's blood pressure was low the entire time they were in the hospital. So figuring out this little piece of information completely transformed the patient's hospital stay, right? You have something. As a student, you do. I just think you have to sit down and think about it. And it's why I encouraged all of you, like back in June, and I said, if you have impactful patient encounters, log them. You think you're going to remember all these great things you've done since June, July, you're not. You need to have a place where you're writing down all these cool things that you're doing and these cool interventions. If you have an interaction with the provider that was not really great, right? Write it down, because it comes up, like a difficult situation with a doctor, how did it end? But if you don't write these things down, unless they were super traumatic, you're not going to remember it. And you want to remember the good as well as the bad. I have the chat again. So let's see. Oops, the chat. Okay. If you have an interview where you did a rotation, okay, for the question, what is your favorite rotation? Is it okay to say another hospital was your favorite? Oh God, Mercedes, that's such a great question. Oh, but that would be lying if it's not. If it's not your favorite rotation. I'm trying to see how you would structure that. Yeah, I don't see how you could weasel out of that. Because if you're interviewing somewhere where you've done a rotation, something there attracts you to the program. Something there does. And so for me, you have to gas them up a bit at that point and just say that this would have to be my favorite rotation for the following reason. If it's the people, if it's that you felt supported, that's usually one of the big things I tell you guys. Like, if you felt supported during your rotation there, or you saw how the residents are supported through their learning experiences and that attracted you, yes, then name that. But I don't see how naming another hospital when you're in an interview somewhere where you've been, yeesh. My advice is, yeah, you have to say that hospital. The STAR method, yes, these would be it. You're welcome, Mercedes. So these are more of the self-awareness. One hardship you face during a clinical rotation, that is no different than the difficult doctor. This is what I mean. Like, if you picked 2 or 3 in each of these categories and prepared an answer, you could answer any one of these that they come at you with that situation, right? How do you deal with conflict? If there's a question to have a prepared answer to, it's that one. Please, whatever you do, it cannot be that I avoid conflict. That cannot be it. Whatever you do, I avoid conflict, cannot be it. Conflict is a part of medicine, right? It's a healthy part of life in general, but it's a part of medicine. As the pharmacist, you are the #1 advocate. Like, you are the gatekeeper between that patient and a medication that the nurse is going to administer. Your ability to figure out how to deal with conflict, but also how to resolve conflict effectively so that that relationship is not fractured moving forward is going to be incredibly important, right? So I know, like, my classic response to how do you deal with conflict, I always say, I deal with conflict head on. I see conflict as the number one reason for conflict being a lack of effective communication. That's the number one reason for most of the conflict that I encounter in practice, right? And so for me, the best way to resolve any conflict in the workplace is to begin establishing a more effective way of communicating so that we are clear, concise, and on the same page about what each of our goals are. It works for me, right? So it's conflict is communication. There's no doubt about that part. And so your ability to resolve conflict, you want to have a plan, because this question will come up in either straight up like this, how do you deal with conflict, or another way, like, you had another pharmacist that disagreed with a recommendation you made. How did you deal with that? Or you have a doctor, you made a recommendation and the doctor rejected the recommendation, even though it's the right thing to do for the patient. What would you do? What would you do about that? You approached a preceptor to get a day off and the preceptor declined it, even though your director has approved it. How would you deal with that? That is nothing but conflict, right? So having a clear stepwise approach on how you deal with conflict would be my number one recommendation. The chat, I have a question on someone who overthinks everything. Yes. When they ask things like this, should we ask with who? More often than not, if the interviewer, that question is Sahara, I think. I'm pretty sure it was Sahara, yeah. So if they are asking you, how do you deal with conflict? A well-structured question will tell you clearly who the conflict is with, right? They may say, tell me about a time you had a group project but had conflict with one of your team members. It will be straight up. Or you had a miscommunication with a team member. Another common example is like, tell me about a time where understanding somebody else's perspective helped you to resolve an issue. That is still conflict. That is still, right? That is still you taking a minute to understand the other person's position well enough to see how you guys can come to a resolve. That is still conflict dressed up. Tell me about a time you had a conflict with a professor, a teacher. They'll use somebody that is like in a teaching role. And how did you resolve it?
Dr. Triori?
Yeah.
I had I don't know if it's going to be helpful for people because I don't know who is applying to the same programs as myself, but I had a question related to that conflict thing, but it's in a different way. It was, you are working as a pharmacist in a hospital, and the doctor prescribed Entresto, which it's not, basically it's telling you the situation that medication for that patient is not the right, it's not evidence-based, and it's not, what they should be taking based on what as a pharmacist. Yeah. And they went on to ask, how would you go about the situation to inform the provider that this is not correct? No, asking you, like, when I looked at it, because I did send you a message because I was like, they're not asking you about Entresto. Yeah. How is it that you deal with other people that have made decisions and how you interact with them and collaborate to, for better patient health outcomes, and don't want to know what steps would you take to, and is it the right steps that they want you to follow in a hospital protocol? How do we go about doing things? And it's all about hierarchy and going about doing, drug information. They're trying to see if you know that you should check guidelines. Yeah. And what's the drug information that you need to do drug information, and that you can consult with your other colleagues. And then you need to have a conversation with the doctor. And how would you, they also want to know how you're going to have that conversation with the doctor. You're not just going to attack the doctor. Hey, no, more like coming from a place of understanding. Maybe the doctor is aware of other things you might not be aware of, and what is the treatment, and maybe that's where you can have the little parts filled in. Yeah. you come to a consensus for the better, you always want to end with patient outcome.
Patient outcome.
Yeah.
Patient outcome reigns supreme, right? So that's a great example, because you could go through all of the right steps and then get to the provider, and it's an example of the provider gives you their perspective and you're like, oh, well, the chart doesn't say that. You had no way of knowing that, but understanding now the provider's perspective, you understand why they're going off guidelines and why they're going rogue, right? But yes, so this is a common question, having a stepwise approach as to how you would solve any problem, even if the problem is not labeled a conflict. I guarantee it, conflict resolution is what they are looking to see, that you have the skill set, or at least know when to get back up and how you would go about resolving them.
Don't
And
tell
that example. Yeah.
say
So
anyone.
there's a question in there already in the chat about the STAR method, and this is it, right? So each of these tell me when should really be very well laid out. I always put an L at the end of the STAR approach, because I think everybody does the STAR part really, really well, but people forget that there's always a lesson in each of these, right? There's an adjustment in behavior, there's a change behavior, there's a change in perspective, there's knowledge gain. I don't want you guys to not take into account that that's something you want to verbalize, because every single thing that happens to you, whether you're aware of it or not, is a learning experience. And so making sure that you're describing what those learning experiences are is very important. The other part of the STAR approach that a lot of people miss the mark on is that they focus on the other part, the other person's role. This is all about you. This is about what you did, what your goals were, what you wanted to accomplish, because in the situation, you're already going to set up the situation for it to be clear that the other person in this scenario was on the other spectrum of where you were operating from. But we want to be able to follow you and what you did and what your behavior was and how you resolved it, and then what you learned from it, because it's all about what you took from that and moving forward, how that's helped you as you move forward. I'm checking the chat because I know that this tell me when is a huge part that a lot of people hate dealing with during the interview. When we are talking about projects you have done with the partner, do we try to avoid speaking on the partner too much, as in giving them too much praise? So if, oh, sorry, I'm going, no, I'm sorry, guys. All right. If the partner, so I don't believe in doing anything that wasn't factual. If the partner didn't pull their weight, that's what happened. They didn't, right? If the partner pulled their weight and the partner was a great partner, they will ask you that. When was the time like you had a great partner and what was your role in accomplishing the project? That partner, yes, giving people their due credit is part of professionalism, right? Because it's not this whole idea that you and only you can do everything well. Pharmacists were type A. Nobody can do it as well as I can. That's just how we are all conditioned. It's like, you did such a great job, but in my head, I know like if I was doing that, I would have done it slightly differently and would have been very pleased with myself with my little modified approach, right? We have a lot of trust issues. It doesn't matter if a pharmacist tell you, I already checked this lab and checked that lab and this is the right dose. When you come on, you're going over the labs again. You're going over everything again. We have trust issues and we're type A and believe that the way we would do it, nobody else can do it that way. But that becomes challenging in teamwork because what we do, we work with so many different people. If anyone has any questions about STAR and my little modified L and want to ask me specific questions, please do not hesitate to reach out to me about anything at all. The clinical challenge. I don't know why you guys get so nervous about this. This was the part I was excited about because I could prepare for this in a factual way, right? The other questions, my nerves could get the best of me, like somebody could throw in like I'm in the middle of answering my questions and then they hit me with well, what did you do? And I'm like, yeah, and I start stuttering. This, I couldn't be touched. I could identify all of these top therapeutic areas and go through my RX prep chapters and make sure I am up on it. And if we sat down for these case discussions, like, I was ruthless with these. And like, I will prepare you to be equally ruthless with these. It's about making sure that they know that your basic pharmacology and your pharmacology fundamentals, you have them down. They're going to tell you that they are not, it's not whether you have the right or wrong answer. We just want to know your thought process. So I will also coach you and how you make sure that your thought process, you run through them as you present these patients, right? So patient who's on Lovenox for 5 days and INR is still therapeutic. What do you do next? Stepwise approach. Well, I need to make sure patients taking their meds appropriately. Are you taking them? Drugs don't work if you don't take them. So the first thing that goes through my mind is that, are you taking them? Are you administering the Lovenox appropriately? And are you taking the warfarin the way you're supposed to take it, right? Then I get into my drug interactions. Has the patient started or is drinking anything that could be affecting it? So these are like the things you can prepare for as you face these clinical challenges. Heart failure is going to be big this year. I can't state this enough. Of the guideline changes we had in 2020, between 2019 and 2020, CHF and diabetes have seen the most significant advances in clinical practice. If you don't brush up on any other chapters, I kindly ask you to brush up on SGLT2s as a drug class and brush up on SGLT2 role in heart failure management. You need to understand Entresto in and out. You need to understand how to transition someone off lisinopril or any other ACEs or ARB onto Entresto, right? If you're going to start somebody on Jardiance or Farxiga or any of these SGLT2s, what is the number one safety parameter you need to know, which is their renal function? What is the number one adverse effect you're going to educate the patient about? UTIs, right? Because they're going to be pissing cupcakes, right? So those little things that you probably just don't even think you'd get asked, but that's basic pharmacology. They will ask that. Hypertension, it's just about the goals. If you know the goals and you know your 4 top drug classes, and you know that beta blockers are only come in if the patient has a compelling indication, right? The top 4 classes, ACEs, ARBs, CCBs, and thiazide diuretics. Metoprolol only comes in if the patient has a compelling indication. Compelling indications are heart failure and cardiac issues like my actual post-ACS, right? If the patient has had an MI, the beta blocker has to be started within 24 hours after that event, right? We'll have a whole another workshop on clinical challenges and clinical pearls that I will host, but these are like the little things that will earn you bonus points, and you don't have to spend all night memorizing any of it at all. My chat box blowing up. Yeah, so, okay, so somebody, Janine, your example's already been Entresto. Yeah, is this next week? Yes, it's next week, Janine. The clinical challenge cases, they're gonna vary, right? They're gonna, like, you see unique things. Like, I thought this was very interesting, like PTT or APTT versus factor 10 for heparin monitoring. The number one issue here is cost. One is more expensive than the other, right? Otherwise, institutions that have been able to switch to factor 10A, they find that they're monitoring less frequently and they get patients to factor 10 therapeutically quicker than PTT. But then if I'm interviewing you, I will ask you, what is the biggest problem with monitoring factor 10 if the patient was taking a DOAC at home, right? So we'll go over that next week, because that's gonna be your biggest trick question, right? If they're on a DOAC at home, what do you expect that factor 10 level to be? And how do you interpret that and decide that it's safe to or not to start heparin. I put CAP here, but this is all of pneumonia, guys. Like, pneumonia guidelines did get updated recently. And the biggest change that happened is the fact that anaerobic coverage is no longer needed unless the patient has an empyema. Pneumonia coverage no longer requires anaerobic coverage. This is a big deal because this means that everybody who's going around slapping Flagyl onto their pneumonia regimen, it's no longer required, right? They may give you a clinical case where knowing that little nugget will earn you a whole bunch of points. This is a straight recall thing. Gentamicin gold for peak and trough. What can cause QT prolongation other than drugs? This I thought was interesting. It has surfaced as a question in my pool for the last 4 years. And until last year, I didn't prepare for it because I kept thinking it was an outlier, but they seem to love it in the Midwest. I don't know. It keeps coming up for my people interviewing in Midwest programs, but I never anticipated that they would ask you like disease-related reasons. It would always be, what are drugs that cause QT prolongation? I have plans to prepare you for that. But then this one question keeps coming up. So I'm putting it on your radar this year. The biggest thing is going to be left ventricular hypertrophy. So people that have heart failure tend to be at a higher risk for QT prolongation for reasons none other than the fact that their ventricles are all bulked and stiffy. We'll cover that as well. Medication reconciliation, it'll almost be like you're setting yourself up for failure if you don't know all of the fundamentals of medication reconciliation. How do you do them? And if you're given a patient case, looking at the home meds and the inpatient meds and looking at the patient case to decide, what do we continue, what do we stop, and why? That's basically how all the MedRec questions surface. Do not guess. Please don't guess. Whatever you do, do not guess, right? The guessing part of your career is forever over because your decisions will have direct outcomes. Like, there are people on the receiving end of it. You cannot guess. They may ask you straight up, go ahead and guess. In which situation? If you guess, you have to explain your point of uncertainty, right? So let's say they ask you, what is the treatment, the DVT treatment regimen for Eliquis? Somebody has a DVT or a PE, you need to start them on Eliquis. What is the appropriate regimen on that? And they tell you, assume that the patient's renal function is all fine, right? So you sit there and you're like, I know it's 10 milligrams BID, but I can't remember if it's for 7 days or if it's for 21 days. So you're stuck. You're like, I know my dose is right, but I can't remember the induction duration. And then you go, okay, and then it's 5 milligrams BID thereafter. So they may tell you, okay, I want you to guess. The way you explain your uncertainty is, you're like, I know that between Eliquis and Xarelto, one has an induction period of 7, the other has an induction period of 21. I can't seem to remember which one is Eliquis or Xarelto. That is great, because that shows that you have baseline knowledge and you could just be getting stuck on a minor detail right now, and that's okay. But you should tell them, how would you confirm that? I would probably pull up the drugs monograph on either UpToDate or Lexicon and go to the treatment section. Always tell them how you would go about removing the uncertainty, because that also gives you bonus point and knowing that you know the right resources to use to answer the questions. The reason is to see how you think and how you arrive at your answers. Sometimes you're going over these cases with residents. In my experience, residents are far more critical than preceptors. You know, they tend to come from us like, I knew that when I was graduating. I don't know how come she doesn't know that. I don't know how come he doesn't know that. Residents tend to be way more critical. When your director reviews these, they're just looking to see that there's baseline knowledge there. And I can't stress enough to review the basic pharmacology. It will be big. Let's see, and hospital protocol, if there's one, yes. So if there's a hospital protocol, ask for the hospital protocol or following what the hospital protocol is. It just so happened that if they ask you for a DOAC, everybody uses the same thing. There are no modified protocols. The fun questions, they're here for you to review. I'm not sure that there's a right or wrong answer. I have just had some super interesting answers to some of these. Like, what is your most prized possession? Some people get very personal, like my mother had a locket, my mother died of cancer, and the locket she wore, that is my most prized possession. If I lost that today, I would literally feel like the only thing that kept me connected to her is gone. That is like close to the heart, very personal. And some people say it's like, oh, my car. It's like, I love my car. My car is, like, is their most prized possession. But I don't think there's a right or wrong answer. It just gives, like, a girl told me once, like, her first pair of Louboutin that she bought herself is her prized possession. People come with all kinds of questions, right? If you were a drug, which one would you be? Please have a prepared response. People, some people say, I want to be an SSRI. I love to make people happy. I think mental health is a great disease, is a horrible disease that takes great joy out of life for people. And I have a very bubbly and happy personality. Like, if I could be a drug, I would definitely be a serotonin uptake inhibitor. Like, they'll say Zoloft or something like that, right? Other people, their answers are like more profound. They'll say, like, I want to be something that changes the world. Like, I would be a drug that changed the world. I'd be penicillin, right? Like, penicillin opened the floodgates for us to explore this whole other area of medicine that we didn't even know existed, and it was an accidental find. Some people talk about a drug that was on the market that was pulled off and reintroduced because they feel like, okay, I think that I haven't been given a lot of chances in life. Like, I got into, like, I don't know, pharmacy school and then dropped out because of some reasons. And then I came back and now I've been great. Like, I'm doing so amazing. So people, there's so many examples of drugs like that were pulled off the market because we didn't know they caused some kind of cancer or something like that. They work on it, reintroduce it, and it completely changed the game, right? Some people say that they want to be epinephrine, right? They're like, it's a life-saving drug that has no abuse potential at all, and it saves lives. They want to be a drug that saves a life. Like, I've heard so many, I want to be a disruptor. Like, someone said they want to be Jardiance. They want to be a disruptor because Jardiance has come and kind of blurred the lines between treatment for diabetes versus heart failure. It belongs everywhere. They identify with that because they think that they're going to be the type of pharmacist that kind of pushes boundaries and stuff like that. So your personality, and then look for a drug that has a similar story. Describe yourself in one word. Please make it one word. Don't give me 3 single words, like one word. This one, if you could have dinner with anyone past or living, please stay away from politics and religion. I want to beg you to stay away from it. Regardless of how strongly you feel about it, let this be the one arena that it does not come into, please. But I've had people say Beyonce, Nelson Mandela, Barack Obama, which at first I'd say that's a political response, but then they explain why Michelle, like every time people have said Michelle and Barack Obama and explained that they feel like they are a representation of what is possible being a minority in America, then I'm like, okay, that's not as political, I guess, but I tend to try to stay away from political figures. That would be my advice. And I also coach, like, the people that I'm with. I tell them, let it be somebody in your life. Mine, it was my grandmother. I've told this story to all of you before, but like my grandmother, who I've never met before, but every time I visit Africa and I go home and I visit my grandmother's village, The old women that grew up with my grandmother, they cry when they see me because they say that I'm the spitting image of my grandmother. She died when my dad was only 15, so I never even had a chance to meet her. But they share all these stories about how brave and courageous she was as a woman in that time. And so it gives me a connection to understand that I come from like a line of strong women. So I would want to meet her. I would want to talk with her and learn more about where her courage and strength came from, since I feel like mine definitely comes from her, right? So powerful things like that, I think, make a huge impact. Like people that have had parents that passed away and the relationship wasn't great. This is a chance for you to share or leave a piece of yourself behind, because I guarantee you, most people want to have lunch or dinner with a celebrity. So try to be original. So Joy is asking, should you also stay away from religion if one of the hospital you apply to has a mission that practices religious, that has and practices and vision? So this is a delicate one, but the reason why, Joy, I would stay away from religion completely is because there are people in that hospital that are helping make that vision come true, regardless of their religious belief. So the hospital's initial inception could have been religious. A prime example of this is like Georgetown University Hospital, right? It started with a bunch of nuns. That is not what Georgetown is today, but that mission and that initial vision of how the hospital's inception came about is held up as a legacy of the hospital. But the hospital's mission is to be a solution for the community. So that would be like my approach to supporting the hospital's vision. I'm certain of it. Whatever their mission and vision is, despite being a religious institution, it centers around helping their community achieve greater and better health, if that makes sense to you. Oh yeah, absolutely, Joe, you're welcome. So current events, they will ask you these, but I think it's just like to see how tuned in you are. But I will tell you, with the pandemic, like of all of these, the one that shocked me the most is this, the 2006 Medicare Modernization Act, that they actually asked that, right? That, as soon as the candidate got back to me and said that he got asked this, I was like, what? I was like, I don't even know this. I have to Google it. I don't even know this. So I don't know what the purpose of asking you this was. But it's about medication access for the disabled and those over the age of 65. It actually passed in 2003, then got enacted in 2006. Now that I'm in MCare, I know what this meant for helping Medicare patients, but I just thought it was way of a reach for pharmacy resident candidates. However, these two, what is one interesting issue facing pharmacy today? You should know. And do you think what is a major problem facing pharmacy today? Interesting issue, major problem. Major problem right now that I can tell you is a buzzing topic is work condition. Overworked, burned out pharmacists, not enough mental health resources to support healthcare professionals in general. That is a major problem right now. As far as an interesting issue, everybody in pharmacy right now is chasing provider status to standardize billing and reimbursement models for pharmacists that are providing care. We continue to be the only healthcare professionals in this country that give away their knowledge for free, like for free. People can walk up to the counter and we can tell them, take this for your skin rash, take that, and we can't bill for it. It's completely free, right? You call your PCP's office, if you come in and they see you for 15 minutes, you pay for that, right? So this is an interesting issue, and this is a major problem. Recognize the difference between the two and be able to do your homework. Like, just don't do your homework. Just things that are online are great, but if you know things about the program that are not printed or posted anywhere, that really shows that you went above and beyond to learn about them. The best way to do that is to talk to residents, right? So if you're talking to people, if you're interviewing at a program where they published a lot of case studies and things, look them up. You can do a simple PubMed or Medline search of either the institution or the people that are interviewing you, if you know their names, and they'll tell you if they've got anything that was published, or if they were residency program of the year, what year that was. Like, there's so much you can learn about them. Do your homework. That's like prep number one. Showing up prepared, just it adds to your confidence in a lot of ways. Drafting a script. Please don't write a paragraph. I'm begging, don't write a paragraph. You may not think that you will, but you're going to be 150% tempted to memorize the paragraph. And if the slightest thing happens to you where you forget the next sentence, you're done. You're going to sit there and be super nervous and like, oh, I forgot to say that sentence. I forgot to say this. I forgot to say that. Bullet points and talking points. So where you are now, talk about this experience, where you're going, and why the program. That's like my biggest number two advice, just paragraph form. Practice. Like, I don't even care who you practice with, like, just practice talking about yourself. This is not as easy as you think. It's really, really not. The moment you start practicing, you're going to realize that you need help doing it. Sit your grandma down and say, hey, grandma, let me tell you about all the things I've accomplished in pharmacy school, and practice summarizing your CV, right? Like, if you're on the phone with best friend and be like, okay, between now and every interview, every day I'm going to call you and run you through my responses to one of these scenarios. But there has to be plenty of people in your life that will be willing to give you, remember, each response, no more than 2 minutes, that can give you 2 minutes per question for you to rehearse this. And as you practice them more, you figure out creative ways to rework them, creative ways to tell the story so that you're not losing your audience, right? Questions to ask during interviews. I put these up here because I record so that you guys can go back and review them on your own. But essentially, you need 3 sets of questions. There are the questions you will ask every person you interview with. Ask them either the same questions or a series of one of these questions. And then there are questions for the director. And I encourage all of you to be ballsy. Like, this is go hard or go home time. You cannot go in there and ask super conservative questions like, what is your favorite resident? What is the qualities of your favorite resident? No, you're interviewing the director. You need to ask them, what are changes that you've made that were a result of resident feedback? That tells you if the residents' feedback are taken at all, right? What challenges do you anticipate for the program in the next year? That way, if she tells you, I anticipate that we could lose 2 or 3 preceptors for this area, you come into the program knowing that, okay, the emergency department rotation may have to be later because one of the preceptors for that position is leaving. And she was transparent about that, right? What do you feel is a unique quality? I'm sorry about my typo. What do you feel is a unique quality of the program? Unique quality of the program, right? And why did you become director? I don't understand why anybody wouldn't want to know that. It's a voluntary position. Like, it's not a mandatory position that you get like paid a whole lot of extra for. People who take this on, take it on because they're passionate about education and they want to make an impact in training future leaders. You want to know why they stepped up for this, right? These 2 questions take guts. Some people are willing to take the risk, and some people are like, nah, what if they say this, and I don't have a response? Prepare a response. What reservations do you have about my candidacy for a position in your program? Put it out there. It not only screams that you have a lot of courage in asking the director if they have doubts about certain experiences you don't have, but by putting it out there, hopefully it gives the director some guarantee that you're prepared and you can take it, you can hear it. Because a lot of you are going to be saying how you seek and apply feedback, you can take criticism and all this other stuff. This is an actual opportunity for you to show that, instead of just saying that I take feedback. But it's like, tell me, what reservations do you have about my candidacy? If she says, no, we have none, great. drive your case home. This is great because I really feel like I could be a fit here. I think that my interest and my personality could really be a fit here. If she says, well, I'm a little concerned that you don't really have much of a research project experience, and defend that. What I lack in research experience, I really make up for in these other areas, and then lay it out. Don't focus on what she just told you don't have. Redirect her back to all this other stuff that you have that makes you a stellar candidate, and then tell her, like, with the research experience, again, I'm coachable and I'm eager to learn. So I have no reservations about my ability to really step up to the plate and learn how to do anything. And I just want you to know that I am committed and willing to do whatever it takes to assure my success in your program. This is a last ditch for you to really leave all of it out on the table. I want to encourage you to really be brave enough to ask it and be ready. It could come out smooth. It could come out very wonky. Regardless of what they say, you're prepared with one or the other to defend your position and why you should have a spot in their program. These are questions for the residents. It's like, where do you live? Work-life balance. How do your projects get assigned to you? Do you pick them? But please don't play yourself in thinking that your interview or your lunch with the resident is not an interview. It is still an interview. As long as you are on that campus, you are interviewing until you get in your car or your Uber and drive off. You're still interviewing. Be gracious to everybody you meet. It's so nice to meet you. Thank you so much for the hospitality. Thank you so much. I look forward to it. Like, just stay on. Don't allow yourself to fall off at any point. Questions? I know, okay, I have one in the chat. Janae, they ask you what animal you would be. You're having a lot of these weird ones already. Questions, anyone? I want to make sure the questions are captured in the recording, since I know that everybody has a different level of comfort with asking questions and that they're included. As far as how to reach out to me, info@resiprep.com. We are on LinkedIn. Listen, guys, I have so many of you tuned in today. Go to LinkedIn and follow our page. Follow ResiPrep 360, the page, please. Oh, Joy, I'm so glad. I'm so glad you enjoyed it and you found it helpful. Please let me know if I can be of help. I really and genuinely believe that the residency application process, it's just about you guys having the right tools. This idea that only qualified people match, it's a myth. It's a myth, right? It's like, you have to understand that, unfortunately, it's a game, right? You're like, that's why I call it the pharmacy Hunger Games. You're playing a game, and I want to have these workshops, and I'll share and have invites out again for the clinical challenge workshop as soon as I have a date. But yes, within the next week, I hope for us to reconnect again and go through the clinical challenge and just share some pearls with everybody. But you got this.